let's talk about glute pain and some possible radiating symptoms due to sciatica in what I call the frontal plane, which is side to side. Oftentimes people say you're having glute issues because you might have this anterior tilt or posterior tilt, but we don't look enough at what happens side to side, which is why when I work with my clients, we're looking at trying to correct any sort of shoulder shift, which would actually help realign the spine. But the second part is that the glutes and the piriformis muscles, the outside rotators here are responsible for hip extension, hip abduction, as well as stabilizing your hip when you are on one leg. And so what that means is if you're standing and your painful side is here and your painful side kind of shifts over to the painful side, it will actually place a good stretch, a fair amount of stretch on the piriformis muscles and on the glutes as well. And so when you take a muscle and you stretch it out, it's going to feel tight, it's going to feel painful because it's just trying its hardest to hold on to that position. So how do we fix this position? One of the best things that we can do is simply change how we stand by actually placing your weight, hips evenly distributed over your feet. If you notice you're going like this, one thing that we can do is actually do a lateral hip shift. You take your hand on the side of the hip shift and then you give yourself a nice little push. The idea is that right now that glute is lengthened, you push your hip out to the side, it is shortened, taking the tension off of that sciatic nerve. And this is an area that should be looked at, if not addressed already.